Hello everyone, this is Chadi from CVI 2023. I'm really privileged to be with one of the presenters at CVI 2023, Thanasis Rempakos, talking about procedure time and CTO and patient outcome or success. Thanks for being with us.
Thank you for having me.
So walk us through the hypothesis of your study.
So for this study, what we wanted to look at is how procedure time correlate with the outcomes of CTO PCI. So what we did was we divided the procedure into 3 parts to make it more easier to interpret the outcomes, the results. So the first part is the time from access to wire insertion, and we did not find any significant differences between successful and unsuccessful cases in that part, which I think makes sense. Then the next part was the guide wire manipulation time, which was defined as the time from wire insertion to lesion crossing or wire removal if we couldn't cross the lesion. And we found that that was the part where we had the most significant differences between successful and unsuccessful cases. So the median time was around 25 minutes for successful cases, which is less than 30 minutes, which is the...
25 minutes average?
Yes, the median was
okay.
25 minutes for successful cases, and it was, I think, around 100 minutes for unsuccessful cases, which is a very big difference. And then the last part was from lesion crossing to end of case in cases where crossing was successful. And we also found that this was also different in successful and unsuccessful cases, but it wasn't, the difference wasn't as big as it was for guide wire manipulation.
So for the last part, the operator crossed the lesion,
but yes,
and then there is stenting, ballooning, and stuff. So there was there a variability, or was in the duration of time?
The main thing that caused differences was balloon and dilatable lesions, because and that's most of the cases that were unsuccessful after lesion crossing were due to the lesion being balloon and dilatable.
Yeah.
So that's what caused the
And what was the median again?
The median was I think it was 50 minutes.
Okay. So is there a difference, or have you looked into different cath labs, or this is just in general everything?
We did look at different cath labs, and we found something very interesting, that cath labs that offered CTO fellowships had much longer procedure times. And this makes sense because they have fellows doing cases, and this increased the procedure time. But there wasn't a big difference in terms of outcomes.
Okay.
So between the centers.
How about in terms of volume? Did you correlate that with number of CTO per year?
That's a very good idea. We didn't actually do that.
But maybe look into that. That reflects the experience, maybe.
Yes,
yeah.
that's true. That's a
very
good
important
point.
study. Yeah, thanks for sharing with us.
Thank you.
Yeah, this is kind of pushing the envelope more towards the CTO and kind of people how to tune. But that's a very important aspect, because I know Dr. Balak is fully aware of a big advocate for radiation safety.
Exactly.
So the longer you are, yeah.
Exactly, and the global CTO algorithm also advocates considering stopping the case after 3 hours. And we saw in our study that when procedures have been going for longer than 3 hours, the likelihood of it being successful was less than 45%, which is
important too as well. Yeah. Well, thank you so much, Thanasis, for your time and for sharing your experience. Please watch these videos and others on CVI YouTube channel. This is Chadi from Austin. Thank you so much.
Thank you.